Everything in the hospital seemed too white, too bright. Ethan Brooks sat slumped on the gurney, his breathing shallow, his heart thudding like a bass drum in his ears. The fluorescent lights above made his skin look even more stretched, more distorted than it already was. His left cheek, once clean, defined, and lined with the thick beard he took so much pride in, was now grotesquely swollen, ballooned to the size of a melon, red and purple streaks cutting across taut skin like angry rivers. His eye was nearly shut, pinched upward by the unnatural bulge in his face. Pain radiated across his jaw and up through his temple like fire, pulsing with every heartbeat. He could barely speak. His words were muffled, slurred, not because of confusion, but because his face physically couldn't form them. The ER nurse had taken one look at him and called for a trauma room. That's when Dr. Lawson came in, young, sharp, confident, until he got close enough to see Ethan's face. Then the air shifted. Calm professionalism turned into urgency. "How long has it been like this?" Dr. Lawson asked, already pulling on gloves, his voice tight. He didn't wait for Ethan to answer, before tilting his chin slightly to examine the damage. "Touch tender?" he asked, but Ethan barely managed a nod before flinching as the doctor pressed lightly on the swollen area. Beneath the skin, something shifted, a wave of pressure that felt as if it could burst at any moment. "Jesus," the doctor muttered under his breath. Then louder, to the nurse behind him, "Page Oral Surgery and ENT. We need a CT scan of the face and neck, contrast stat." "What's happening to me?" Ethan finally forced out, voice thick, half paralyzed on the left side. Dr. Lawson met his eyes with a steady seriousness that made Ethan's stomach turn. "This isn't just an infection," he said. "It's a facial abscess, and it's not small. It's deep, spreading, and dangerously close to critical structures. If it moves into your airway, or the blood vessels that lead to your brain, it could kill you." That word hung in the room, kill, like a weight too heavy for the sterile air. Ethan's hands trembled. Less than 2 days ago, this had been a minor irritation, a tiny bump under his beard, a nuisance, something he'd planned to deal with during his lunch break. Now he was lying on a hospital bed, his face unrecognizable, a medical team preparing to wheel him away for emergency imaging and likely surgery. He could hear snippets of conversation, orbital involvement, risk of cavernous sinus thrombosis, airway management might be necessary. They were talking around him now, not to him. Talking fast, moving faster. A nurse inserted an 4 into his arm. Another adjusted monitors. The room blurred for a moment, as his pulse rose, panic rising in his chest. He turned his head slightly, just enough to catch a glimpse of his reflection in the shiny metal panel on the side of a nearby cart. It took a second for him to realize he was looking at himself. The shape was there, the outline of a man's face, but twisted, bloated, almost monstrous. His left cheek stretched outward like it didn't belong to his skull. Skin glistened, slick with sweat. The beard he once groomed so meticulously was soaked with antiseptic and clinging to swollen flesh. His eye, barely open, looked like it was being pushed out of its socket. He looked like someone who had been stung by hundreds of bees, or worse, someone who was rotting from the inside. That's when the fear really hit him. Not the kind of fear that makes you gasp, the kind that sinks into your spine, turns your hands cold, and makes time feel both too slow and too fast. He thought of Amber, how she'd looked at him that morning with concern in her eyes, how he'd waved her off, how he told her, "It's just irritated, I'll take care of it tonight," how she'd wanted him to stay home, and how he didn't listen. He thought of the meeting he'd tried to push through hours ago, the one he couldn't concentrate on because of the pounding pain in his jaw, the investors' polite smiles as they tried not to stare, how he excused himself halfway through, saying it was a dental emergency. He thought of the moment in the car 3 days ago, when he first felt the bump and decided to handle it himself. That split-second decision, just squeeze it, like always, now spiraled into something he could never have imagined. And now, here he was, a grown man with his face exploding from the inside out, his identity collapsing with each passing hour. Every part of his body was screaming at him, but none louder than his mind. How the hell did this happen? A voice cut through his spiral. "We're prepping for transport. You're going to imaging, Mr. Brooks," the nurse said. "Stay with me, okay?" He nodded, or thought he did. It was hard to tell. His body no longer moved the way it used to. Pain was the only thing he could feel with any clarity. As the gurney started to move, Ethan stared up at the bright lights above. They slid by like snapshots, each one sterile and cold. In his mind, one question replayed over and over: what if I don't come out looking like me? Or worse, what if I don't come out at all? 3 days earlier, Ethan Brooks was sitting in his car in the office parking lot, waiting for Amber to come back with coffee. It was a bright Colorado morning, cool and dry, with the kind of sunlight that made even mundane moments feel sharp and in focus. He had 10 minutes before a team meeting and decided to use that time for a quick grooming check. He opened his front-facing camera, tilted his head slightly, and adjusted the angle to check his beard. Ethan took pride in his beard, thick and well-shaped, deep brown with streaks of gray near the chin that gave him what Amber called his distinguished look. He washed it with beard shampoo, used oil regularly, and trimmed it himself every Sunday. That morning, though, something caught his eye. A small bump, barely visible beneath the thick hair along his left jawline, right where his beard met the edge of his cheek. He leaned closer to the screen. It wasn't red, it wasn't inflamed, it was just a little raised. He reached up and gently pressed it with his fingertip. Firm but not painful. A twinge, maybe, but nothing alarming. Probably just another ingrown hair, he muttered to himself. Ethan had dealt with them before. It came with the territory. Coarse beard hair, humid days, razor touch-ups during the week. It was bound to happen. Most times he could see the hair just beneath the surface, like a trapped thread. A quick pop, a bit of pressure. The hair came out, and within a day or two the bump disappeared. This one seemed no different. But he couldn't see the hair clearly this time. Maybe the light wasn't hitting it right. Maybe it was just deeper under the skin. He leaned back in his seat, tilted his head toward the window to catch better light, and felt around with his fingers. There it was again. Definitely a bump. Definitely something under there. He could feel the ridge. A familiar irritation crept in. That obsessive itch to fix something. Ethan didn't like letting things go, especially when it came to his grooming. If he saw something wrong, he corrected it. Simple. He opened the glove compartment and rummaged around until he found his keychain. Selecting the smallest key, he checked to make sure no one was looking, then angled it gently against the bump, using the tip to scrape the skin with surgical care. The skin resisted at first, then gave way slightly, just enough to release a tiny bead of clear fluid. Ethan didn't stop. He pressed around the area with his fingers, applying firm pressure. A small amount of white pus surfaced. That was expected. Ingrown hairs often came with minor infection. He adjusted his angle and squeezed again. This time, more pus oozed out, thicker, yellowish white. He could feel something shifting under the skin. A tiny catch, like a hair moving up through layers of tissue. He was sure of it. "Gotcha," he whispered, almost satisfied. Another squeeze, and a small dark thread emerged from the bump, just barely poking through the skin. Ethan used the edge of a tissue to wipe the area clean. The bump was still there, slightly bigger now, but that was normal after extraction. It would go down. He would wash it properly. Home, apply some antibiotic cream, and it'd be gone in a few days. Amber slid into the passenger seat, handing him a cup of coffee. "You ready?" she asked, giving him a quick look. "What were you doing just now?" Ethan gave a half smile, tucking the tissue into the side pocket of the door. "Just cleaning up a beard bump. Ingrown hair." Amber wrinkled her nose playfully. "Gross. You're gonna end up giving yourself staph if you keep doing that." He laughed it off. "It's fine. I've done it 100 times. Part of the beard life." She looked at him a moment longer, then shrugged and sipped her drink. The rest of the day moved on as usual. That evening, Ethan checked the bump again in the bathroom mirror. It was a little red, a little puffy, slightly more than before, but nothing out of the ordinary. The skin was irritated from being squeezed. He expected that. He cleaned it again with soap and warm water, dabbed some ointment on it, and didn't think much more about it. But the truth was, something had changed. Something under the skin had shifted in that brief moment in the car. Something he couldn't see, something festering deeper than any ingrown hair he'd dealt with before. The next morning, Ethan Brooks woke up with a familiar stiffness in his jaw. Not painful exactly, but noticeable. He stretched his neck, yawned, then walked into the bathroom and flicked on the light. The bump was still there. It hadn't gone down overnight like he expected. If anything, it looked a bit angrier. The redness had spread just slightly beyond the perimeter of the bump. Not enough to worry him, but enough to irritate him. He leaned in close to the mirror, brushing back his beard with a comb. He could still see the tiny opening from yesterday, the area where he'd already poked and squeezed. There was no hair visible anymore, but the bump was still firm under the skin, like something was trapped. He gently touched it again. It was definitely warmer than the surrounding area. Probably didn't get the whole thing out, he muttered. He grabbed a cotton swab, some rubbing alcohol, and his old precision tweezers, the kind he used for splinters. Amber was still asleep, so he moved quietly. He sat on the edge of the bathtub, braced his elbow on his knee for stability, and gently pressed the tweezers into the tiny opening. No pus came out this time, but he could feel pressure building underneath. It was like trying to dig into wet clay. He tried to lift a flap of skin, hoping to expose whatever hair was left inside. Nothing. He sighed, then shifted tactics. He placed both index fingers on either side of the bump and pressed inward and upward, just like he'd seen in online tutorials. The pressure made his jaw ache, his knuckles turned white, and then something gave. A sudden rush of thick, warm fluid erupted from the spot, more than the day before. Yellowish white, foul-smelling and slimy. Ethan recoiled slightly but didn't stop. He pressed again, and more came out. Not blood, this was pus, a deep, infected ooze that poured in slow motion. Jesus, he whispered, grabbing tissue after tissue to wipe it away. He didn't remember ever having this much drainage from an ingrown hair. This wasn't a simple bump anymore. Still, he was already halfway in. He had to finish it. He kept squeezing, harder now, hoping for that final pop that would indicate it was over. But the more he pressed, the more came out. And then, oddly, less. The bump remained. It wasn't shrinking. In fact, after each squeeze, it seemed to push back, like something deeper was resisting the pressure. His skin throbbed with heat. The tissue was getting harder, not softer. Something's wrong, he thought for a second. But the habit, the stubbornness pushed the thought aside. Ethan wiped the area with alcohol, applied a generous layer of ointment, and stepped away from the mirror. It's out, he told himself. It's going to be sore. Give it a day. That day at work, the bump throbbed beneath his beard. It didn't matter how many times he told himself it was nothing. He kept feeling it. A dull, warm pulse under the skin that reminded him of its presence with every chew, every word he spoke. He found himself pressing it throughout the day, like a compulsion. Maybe if he just kept applying pressure, it would go away. James, his coworker, noticed. You okay, man? You've been rubbing your face all morning. Ethan forced a laugh. Just an ingrown, being annoying. You sure that's all it is? Looks kind of swollen. Ethan felt a flicker of embarrassment. Yeah. I messed with it yesterday. It'll calm down. But that night, it didn't calm down. At dinner with Amber, he chewed slower than usual, careful not to aggravate the area. He kept dabbing it with a tissue under the table, hoping she wouldn't notice. She did. Ethan, is it still bothering you? He nodded, more annoyed than worried. It's fine. I squeezed it too hard. It's irritated. That's all. You should get it checked out, she said gently. You know how bad that stuff can get if it's infected. Ethan waved her off. It's just a little inflamed. You know how I get with these things. It'll clear up. Amber didn't push. She never did when he got like this. Stubborn, dismissive, defensive. But she did eye the side of his face with a deeper kind of concern. Later that night, Ethan stood in front of the mirror again. Now the bump looked darker beneath the skin, more purple than red. The skin around it was tight, glossy. The opening he'd created had mostly scabbed over, but the whole area pulsed like it had its own heartbeat. He opened the medicine cabinet and grabbed more ointment. This time, he added a warm compress, pressing a damp towel against the side of his face for 10 minutes, hoping to reduce the swelling. He took 2 ibuprofen tablets, climbed into bed, and told himself he'd feel better in the morning. He didn't. By the next morning, the left side of his jaw was visibly swollen. His cheekbone looked subtly pushed outward, like the tissue beneath had ballooned. He noticed it as soon as he looked in the mirror, but tried to rationalize it. It's still draining, he told himself. It's part of the healing. He shaved around the area carefully, trying not to disturb it, but every time the razor got close, the pain flared. Deep, sharp, and unexpected. He hadn't had pain like this from an ingrown hair before. Still, he dressed for work, downed another ibuprofen, and told himself he'd stop by urgent care tomorrow if it didn't get better. Not today. Today, he had that investor pitch. By midday, the swelling was worse. Ethan could feel the tissue inside his cheek thickening. It wasn't just puffy anymore. It was firm, like hardened clay, hot to the touch. When he opened his mouth to speak, it ached from the stretch. Chewing hurt. Swallowing was uncomfortable. James stared at him during lunch. "Ethan, dude, that's not a razor bump. You need to go to a doctor." Ethan tried to brush it off. I know, tomorrow. You sure you can even talk through that meeting later? Your jaw looks off." Ethan ignored him, went to the meeting, tried to focus. But halfway through his pitch, one of the investors raised an eyebrow and interrupted. "Are you feeling okay?" the man asked. "Your face looks swollen." That was the breaking point. Ethan lost his rhythm. He stumbled through the rest of the presentation, barely able to focus through the pulsating pressure in his jaw and the rising anxiety in his chest. He excused himself as soon as the meeting ended and rushed to the restroom. In the mirror, he saw what the others had seen, an asymmetrical face. His left side was puffed, discolored, visibly inflamed. The skin beneath his beard was stretched, tight, shiny. He ran his fingers along his jaw, and the pain nearly made him drop to his knees. It was no longer a minor irritation. It was something else entirely. Ethan Brooks woke up on Wednesday with the strange sense that something was pulling at the skin on his face. As he sat up in bed, a wave of tightness spread across the left side of his jaw and cheek. His eyes flicked toward the mirror across the room, and what he saw made his stomach dip. The swelling had advanced. The lump that had once been the size of a grape now pushed outward like a plum buried beneath his skin. The contour of his face was noticeably distorted. His beard bulged unnaturally over the area, and the discolored skin underneath looked bruised, tinged a dusky red with hints of purple near the center. Amber noticed it immediately as she walked in from the kitchen with a cup of coffee. "Ethan, oh my God, what happened overnight?" "I don't know," he said, his voice slightly muffled from the tension in his cheek. "I think it's just inflamed. I squeezed it too hard. It'll go down." But even as he said it, Ethan knew he was lying to himself. This wasn't typical inflammation. This felt different. This felt wrong. Amber crossed her arms. "You need to see someone. Today. This isn't normal. I've got too much going on at work." The investor meeting yesterday was already a mess. Her expression hardened. "Exactly. You didn't sleep well. You barely ate last night. You're in pain. What are you trying to prove?" He didn't answer. Instead, he went into the bathroom, leaned in toward the mirror, and examined the lump again. It was hot to the touch. Not just warm, hot. And when he gently pressed on the skin surrounding it, the pain radiated down his neck and into his ear. He could feel something shifting beneath the surface, like fluid trapped in layers of tissue, building, spreading. He rinsed his face with cold water, took 2 more ibuprofen, and forced himself to go to work. Thursday morning brought new symptoms. Ethan woke drenched in sweat, the sheets damp beneath his back. His mouth was dry, his tongue stuck to the roof of his mouth. He sat up slowly and blinked away the haze of sleep, and that's when he noticed it. His left eye didn't open fully. He rushed to the mirror. The swelling had spread upward, toward his orbital bone. His lower eyelid was puffed and sagging, the tissue beneath pink and puffy. His eye itself was bloodshot and slightly watery, as if irritated from pressure behind it. And now, there was fever. Amber checked his forehead and recoiled slightly. "You're burning up. I'm getting the thermometer." It read 100.9 degrees Fahrenheit. Ethan sat on the edge of the bed, holding his head in his hands. The pain was constant now. Not the sharp stabbing pain from squeezing, but a deeper, throbbing pressure that seemed to come from beneath his skin, pulsing in sync with his heartbeat. He tried to eat breakfast, but chewing hurt. Swallowing was difficult. Every movement of his jaw sent ripples of discomfort through the entire left side of his face. Amber pleaded with him again. "Please, Ethan. This is spreading. Your eye, your fever. This isn't an ingrown hair anymore. I just need rest," he insisted. "One more day. If it's worse tomorrow, I'll go." She shook her head, clearly frustrated. "You're being reckless. This could be serious." He didn't disagree, not entirely. But something in him, maybe pride, maybe denial, kept him from taking that step. He didn't want to be that guy who ran to the doctor over a swollen jaw. Not yet. That night, the fever climbed to 101.4 degrees Fahrenheit. He lay in bed, sweating through another set of sheets, his body shivering despite the heat radiating off his skin. The pain in his face intensified. His left cheek felt like it was under pressure, like something inside was growing, alive, pushing outward, invading new space. At 3 a.m., he woke up from a dream where his face was cracking open. He stumbled to the bathroom and stared at his reflection. Now the swelling reached from his jawline up to his temple and down into his neck. The skin was pulled taut, the color had darkened further, and tiny red lines, capillaries, spread from the epicenter like spider webs. He pressed lightly on the bump. Something shifted inside, something liquid. He gagged. Friday morning, Ethan couldn't put on a dress shirt. The collar pressed too tightly against his neck, which had begun to swell along the underside of his jaw. His speech had changed too. He slurred certain words, especially ones with M or B. Talking hurt. Laughing was impossible. Even smiling caused sharp flashes of pain. At work, James stopped him in the hallway. "Ethan, man, this is getting scary. You look, no offense, like you've been in a fight with a hornet's nest." "I know," Ethan admitted. "I'll go get it checked tonight." But he didn't. He went home, collapsed onto the couch, and tried to nap. He woke up 90 minutes later with his shirt soaked in sweat and his heart pounding in his ears. His fever now hovered near 102 degrees Fahrenheit. The ibuprofen barely dented the discomfort. Amber came home from the grocery store, took one look at him, and snapped. "Get in the car," she said. "Now. We're going to urgent care. This isn't a suggestion anymore. I can drive myself later." "No. You're going now." "I don't care if I have to drag you." Saturday morning came like a hammer. Ethan could barely open his mouth. His jaw was locked in place by inflammation, and the pain had crept down into his throat and the top of his chest. His breathing wasn't labored, yet, but each breath felt shallow. Uneasy, Amber hovered nearby, phone in hand, ready to call 900 if she had to. "Can you swallow?" she asked. He nodded weakly. "Barely. You're going to the doctor." "Right now." This time, Ethan didn't argue. He couldn't. He barely made it down the stairs without dizziness overtaking him. The fever had ravaged his system. His knees shook. His face, now grotesquely swollen, felt foreign. He couldn't feel parts of his cheek anymore. The numbness was spreading, as if nerves were shutting down from the pressure of the swelling. They drove in silence. At the urgent care center, Ethan walked in holding his jaw, his face visibly misshapen. The staff at the front desk went wide-eyed. One of the nurses behind the counter rose to her feet immediately. "I need to see someone," he said hoarsely. "My face, I can't." She rushed around the counter without even asking for his ID. Within minutes, Ethan was ushered into a triage room. The nurse took his vitals. Fever 101.8 degrees Fahrenheit, pulse 115, blood pressure elevated. She gently touched his cheek, and Ethan jerked away in pain. Dr. Kevin Lawson walked in less than 5 minutes later. He took one look at Ethan and knew something was very wrong. "How long has this been going on?" Dr. Lawson asked. 5, 6 days, Ethan muttered. "Started as a bump. I thought it was an ingrown hair. I tried to squeeze it. Then, it just kept getting worse." Dr. Lawson examined the swelling carefully, his expression darkening. "This isn't just an infected hair follicle," he said. "This looks like a deep facial abscess." He pressed gently near the center of the swelling. Ethan let out a sharp cry. "There's pus under there," the doctor murmured. "A lot of it, and the way it's spreading, up to the eye, down to the neck. We're looking at a dangerous situation." Ethan swallowed hard. "What do you mean?" "I mean this needs to be drained, immediately. And not here, at a hospital. You need 4 antibiotics and imaging. There's a very real risk this infection is spreading into tissue planes that could affect your airway. Or worse." Amber had been quiet in the corner, but now her voice broke. "Wait, you're saying this is life-threatening?" Dr. Lawson nodded grimly. "Potentially. If it reaches certain spaces in the neck or the veins leading to the brain, it could be catastrophic." He stood. "I'm calling an ambulance." Ethan tried to protest. "I can drive." But his words were slurred and faint. His body, racked with fever and infection, had little left to give. The silent progression was over. Now the emergency had begun. As the ambulance doors slammed shut behind him, Ethan Brooks finally allowed himself to accept a thought that had been clawing at the back of his mind for days. He'd waited too long. Now he was in the back of a vehicle with flashing red lights, a paramedic inserting an 4 into his arm, and Amber riding in the passenger seat up front, visibly shaken. His head rested against the gurney, the left side of his face pulsing with heat and pressure. He couldn't fully close his left eye. His jaw throbbed in rhythmic pain. The swelling had crept downward along his neck, tightening the skin and making every breath feel like he was inhaling through gauze, all from a bump. A small, annoying bump. He had dismissed it, pushed it aside, told himself he could handle it. At the hospital, he was wheeled directly into a trauma bay. The ER was a blur of white lights and masked faces. Gloves snapped, voices echoed, monitors beeped. He could hear Amber speaking to someone outside the room, her voice cracking. He hated this. Hated that it had come to this. And yet, he knew he'd done this to himself. Just 4 days ago, he was convincing himself it would go away. That he didn't need to waste time or money on a doctor for something that looked like an ingrown hair. He'd been through worse, right? He was a grown man, a tough guy. People dealt with worse than this all the time. And besides, what was he supposed to do? Take off work? Reschedule a meeting he'd been preparing for 3 weeks just to have someone tell him it was just a skin infection? The idea felt absurd at the time. Self-indulgent. He remembered something his father used to say, "If you're not bleeding out or throwing up blood, you're fine." And that had become his measuring stick for when to seek help. So when Amber gently suggested he see someone, he brushed it off. When James, his coworker, expressed genuine concern, he shrugged it off. Even when his face began to visibly swell, even when the pain escalated, even when the fever crept in and sleep became impossible, he told himself it was manageable, that it would turn around. He didn't want to appear weak. He didn't want to sit in a clinic for 3 hours surrounded by 6 strangers just to be told to wait it out. And then, there was the other side of it, the quiet, gnawing fear, the part of him that had started to suspect something was really wrong, and didn't want to know, because knowing would make it real. Knowing meant consequences. Knowing meant procedures, bills, maybe even surgery. He couldn't afford to miss work. He didn't want to show up in the office with gauze on his face or stitches along his jawline. People would talk, people would ask, so he waited, and now, here he was, in an ER gown, with a temperature of 102.2 degrees Fahrenheit, being prepped for a CT scan, and possibly emergency surgery. The ER doctor, Dr. Rachel Morrison, stood at the foot of the bed, reviewing his chart and images. Her expression was serious but calm, like she had given this speech 100 times. "Ethan," she said, "you have a deep tissue abscess. It's about the size of a baseball, and it's spreading into multiple facial compartments. It's likely been brewing for several days." He nodded slowly. Is it dangerous?" "Yes," she said, not sugarcoating it. "Facial abscesses can be very dangerous when they reach this size. The area around your face has a lot of potential spaces where infection can travel rapidly, into your neck, your airway, even into your brain." His mouth went dry. "My brain?" She nodded. "The veins in your face connect directly to the cavernous sinus inside your skull. If bacteria reach that area, it can lead to a rare but often fatal condition called cavernous sinus thrombosis. It's rare, but it's why we take infections like this very seriously." Ethan's heart pounded against the hospital bed. "So what now?" "We've already called the oral and maxillofacial surgery team. You're going to need an operation to drain the abscess. You'll be on 4 antibiotics for several days, depending on how deep the infection went. You might need drains placed for a while. The CT scan showed early signs of tissue involvement in your cheek and neck." He blinked up at the ceiling. "This all started with a little bump." Dr. Morrison looked at him and spoke gently. "I see this more than you'd think. People try to manage things on their own. They think it'll go away, but sometimes it doesn't, especially on the face. This area is delicate." He nodded silently. Amber was allowed to enter the room once the staff stepped out briefly. She looked pale, her eyes glossy with tears. "I should have forced you sooner," she whispered, sitting next to the bed. Ethan shook his head. "No, I should have listened. I should have gone days ago." The truth hit him all at once. The critical neglect wasn't just about pride or convenience. It was about fear, of embarrassment, of diagnosis, of disruption. He'd convinced himself that ignoring the problem would somehow make it disappear. But now the damage was undeniable. His face was distorted. His body was weakening. His nerves were already compromised. He thought about all the times he touched the lump, all the times he pressed it, hoping for a release. He remembered standing in the mirror with tweezers and a key, prodding, digging. In hindsight, it was insane. He wasn't a doctor. He didn't even sterilize properly. All he'd done was open a door and invite infection in. And now, he was paying the price. As the orderlies wheeled his bed toward radiology, Ethan stared up at the hospital ceiling and asked himself a simple, horrifying question. What if I had waited one more day? Ethan couldn't feel his lips anymore. Somewhere between the CT scan and the gurney ride back to the ER, the sensation on the left side of his face had dulled into a numbing throb, no longer just pain, but pressure, fullness, and an eerie detachment. He tried to speak, but found his words coming out thick, like his tongue had grown too large for his mouth. Amber sat beside him, trying to stay composed, but the fear in her eyes had deepened. When Dr. Morrison returned, she wasn't alone. A second doctor entered the room with her, tall, middle-aged, sharp-eyed, wearing dark blue scrubs and a white coat, with the words Dr. James Patterson, oral and maxillofacial surgery embroidered on the chest. Ethan, Dr. Patterson said, glancing between him and the chart, I've reviewed your imaging. We need to move fast. Fast, Ethan slurred, blinking slowly. How bad is it? Dr. Patterson stepped forward and pulled up a stool beside the bed. His voice was low, measured. You have an abscess that's about 8 centimeters wide. It's spreading through your facial planes, particularly the submandibular and buccal spaces. The CT scan shows signs of pressure around your airway structures. If this progresses, you could have trouble breathing. Amber gasped softly. Ethan looked up, stunned. Dr. Morrison added, there's also visible inflammation in the tissue around your carotid sheath and early tracking into the parapharyngeal space. Meaning? Ethan whispered. Meaning, if we don't intervene, Dr. Patterson continued, you could develop deep neck space infections, which can rapidly lead to sepsis, airway compromise, or even involvement of the venous system around your brain. Jesus. Ethan swallowed. So this is, like, really dangerous. Yes, Dr. Patterson replied. It's life-threatening. Ethan tried to process it, but the walls seemed to press inward. All this, from an ingrown hair. He suddenly remembered the warmth of his car 3 days ago, the key in his hand, the mirror, the squeeze. That moment, that single stupid decision. It echoed now like a drumbeat. I didn't think it was that serious, he said, almost apologetically. It rarely seems serious in the beginning, Dr. Patterson said, but the anatomy of the face makes infections spread quickly and unpredictably. He stood up and nodded toward the hallway. We're prepping the OR now. You're going under general anesthesia. We'll need to make incisions along your jawline and inside your cheek to access all pockets of infection. You'll wake up with drains in place. You'll likely be in the hospital for several days. Ethan's heart thundered in his chest. Amber leaned forward and gripped his hand. Her own hand trembled. Do whatever you need to do, Ethan said. I want to wake up. Dr. Patterson paused, eyes softening just slightly. You will. But this is going to be a tough recovery. I want to be honest about that. A nurse entered moments later with a consent form. Ethan signed with shaking fingers, barely able to grip the pen. As he was wheeled out of the ER bay, Amber kissed his forehead and whispered, I'll be here, the whole time, I promise. They reached the surgical suite quickly. The bright lights overhead, the scent of antiseptics, the mechanical precision of the OR, it all blurred into surreal chaos. An anesthesiologist introduced herself, explained what would happen, and began administering the drugs. Count backward from 10, she instructed softly. Ethan nodded, trying to comply. 10, 9, darkness. He woke up to pain. Not sharp, not stabbing, but deep, raw, all-consuming. Like the left side of his face had been hollowed out and stuffed with fire. The ceiling above him was unfamiliar. Soft beeps echoed to his right. He reached up instinctively, but a nurse quickly caught his hand. Mr. Brooks, she said gently, you're out of surgery. You're in the surgical ICU. Try not to touch your face. You have 3 drains in place. He blinked slowly. Amber's voice came from somewhere beside him. Ethan, I'm right here. He turned slightly, groaning from the effort, and saw her tear-streaked face beside the bed. You made it, she whispered. His throat was dry. Hurts, he managed. I know, she said, brushing his hand gently, but they said it went well. They got it all out. Later, Dr. Patterson returned, his surgical gown swapped for a clean coat, now streaked with pen marks and post-op notes. We drained about 120 milliliters of pus, he said, calmly but firmly. There were 3 separate loculations. One extended into the buccal space, another tracked beneath the mandible. The last was starting to involve the parapharyngeal region. Ethan just stared at him. If we had waited even 12 more hours, The surgeon added, "You might have lost your airway, or worse." The words landed like a brick. It was that close. 12 hours. Ethan felt cold sweat break along his neck. "The good news," Dr. Patterson continued, "is that we were able to remove the infected tissue, place drains, and irrigate thoroughly. You're on broad-spectrum 4 antibiotics now, but there's going to be swelling, pain, numbness. You're going to need time." Ethan nodded slowly. "Scarring?" Dr. Patterson hesitated. "There will be some. We had to make a substantial incision along the jawline and a second one inside the cheek. Some muscle and connective tissue was debrided. But we did our best to preserve facial symmetry." Ethan wanted to ask what some meant, but he already knew. He closed his eyes. The reality of it pressed down like a weight on his chest. He had come so close to losing everything, all for a bump he hadn't respected. Over the next 24 hours, Ethan was monitored closely. The swelling remained severe. His speech was slurred, his face grotesquely asymmetrical. The drains had to be emptied multiple times a day, each time revealing the remnants of what had nearly killed. The ICU nurses were kind but efficient. One of them, a woman named Julia, spoke gently as she adjusted his 4S. "I've seen a lot of these," she said, "facial infections that got out of hand. Most people wait too long." Ethan looked up at her. "Why do you think that is?" She smiled sadly. "Because no one wants to believe a little bump can kill you." Everything around Ethan felt unreal. White lights, the sterile hiss of machines, antiseptic smell that burned his nostrils. He was lying on a narrow gurney, sheet pulled up under his chin. His left cheek still throbbed, swollen, distorted. A thin film of sweat clung to his forehead, and his mouth tasted like metal. He tried to move, to speak, but only a groan escaped. He heard voices, calm, clipped, professional, but every footstep echoed like thunder in his skull. A tall, serious-looking surgeon in dark scrubs, Dr. Patterson, stood beside him, peering down with eyes half hidden under the surgical mask. Nurses gloved up quickly. Instruments were laid out on a stainless steel tray, scalpels, clamps, suction tubes, irrigation syringes. Ethan's heart pounded. He tried to lift his hand, but 4 lines pinned him down. His left arm felt numb, foreign. The surgeon's mask seemed far away, but the words came clear. "We'll access via a submandibular incision, then a second intraoral approach if needed. We need to reach every abscess pocket. There's a risk of vascular involvement, so we must be meticulous." He swallowed hard. His throat felt scratchy, dry. One of the nurses shone a bright light into his left eye. "Hold still, sir." Ethan closed his good eye, tried not to flinch. He dated back to that moment in his car, that tiny bump he had squeezed. How simple it had seemed then. He squeezed his eyes shut, willing it not to be real. Then the anesthesiologist spoke softly. "We're starting the anesthesia now. You'll feel a little cold, then nothing. Just let go." Ethan managed a nod. He tried to count backwards, but his vision blurred, limbs grew heavy, and then came darkness. When he woke up, the world was muffled. Sharp fluorescent lights overhead, monitors beeping gently. His cheek throbbed like an engine revving too fast. A rough bandage pressed against his jaw, damp and heavy. He tried to lift his fingers to feel it, but pain shot through his face. He hissed. A nurse was there almost immediately. "Easy," she said quietly. "You're in ICU. You're safe." He tried to speak. Only a croak came out. "Don't speak yet," the nurse said kindly. "Swallow this water slowly." She held a small cup to his lips. He managed a sip. Water tasted like nothing but relief. Amber was beside him, clutching his other hand. Her eyes red-rimmed, voice trembling. "You made it. You're safe." They got it all out. He attempted a smile, but it sent pain rippling across his cheek and down his neck. Dr. Patterson returned, calm but serious. He pulled up a small chart and began talking softly, methodically. "We drained roughly 120 milliliters of pus, thick greenish-yellow fluid, 3 loculations, one under the mandible, one deep in the buccal space, and a third tracking posterior toward the parapharyngeal region. All pockets irrigated thoroughly. We placed 3 drains, one external along the jawline, one intraoral, one into the neck area. That should allow ongoing drainage and help prevent recollection." Ethan's eyes were dry but heavy. He tried to absorb the information. Pus, multiple pockets, neck involvement, risk to airway, vascular structures. A shiver ran down his spine. "There was mild necrosis of surrounding soft tissue," the surgeon continued. "We removed what was non-viable. I trimmed some inflamed tissue, but we preserved nerves where possible. Unfortunately, you'll have some numbness along the left cheek and jaw, possibly permanent. Ethan swallowed hard. Scarring? There will be a scar along the jawline, Dr. Patterson admitted. Maybe some internal adhesions. We'll monitor nerve recovery, but for now, focus on healing. Ambulant drips, basins under the drains, the smell of antiseptic mixed with the faint iron tang of old blood. Ethan lay back, eyes fixed on the ceiling. Pain radiated, but more than that, a heavy sense of finality sank in. This was real. This was survival. The next hours passed in a blur. Nurses came to empty the drain bulbs, record output. Antibiotics dripped through his sedatives to dull the pain. The bandages felt tight. Every slight movement sent electric jolts through his face. He tried to swallow food the next day, just a thin broth. His mouth was stiff, his lips didn't move the way he wanted. The taste was stale, the effort immense. Amber fed him spoonful by spoonful, gentle encouragement in her voice. Each swallow had him gritting his teeth, fighting waves of nausea and pain. He glanced at the drain bulbs, fluid trickling slowly, tinted yellow-green, a sick reminder of what had happened. He thought of his beard, the one he had groomed carefully for years. Now half of it was shaved away. The left side of his face looked asymmetrical, the scar line along his jaw visible under the bandage. He stared in a small mirror one evening, after the nurse allowed. He hardly recognized himself. His cheek felt hollow. The skin sagged slightly. Part of him felt gone, something wrong with what used to define him, his face, his identity, his confidence. At night, the pain kept him awake. The drains were uncomfortable, tubes taped across his skin made him feel violated. Every shift of the hospital bed reminded him of the fragility of flesh, of how a tiny bump can destroy what feels permanent. Amber slept in a chair beside him, half awake, half listening to the beeping monitors. He heard her soft sob at some point, then silence. He closed his eyes. He wondered if he'd ever look normal again. By day 3 post-op, he was stable but fragile. Drain output slowed. Nurses changed dressings. Dr. Patterson visited daily, checking for signs of secondary infection, assessing nerve function, planning for drain removal when safe. Ethan stared at the chart. Drain 1 to 10 ml, drain 2 to 5 ml, drain 3 to 2 ml. Small numbers, but slowly, they meant progress. He tried to speak more clearly, practice opening his mouth gently. The left side still felt stiff, almost foreign, numbing pins occasionally. A strange, unnerving sensation. Amber sat by him, holding his hand. She brushed a stray hair back from his forehead. "You're alive," she whispered. "That's what matters." He nodded, voice hoarse. "Alive," he echoed. He thought back to that morning 3 days earlier, coffee in the car, beard mirror bump. It seemed like another life. A different man. The bump had disappeared long ago. But what remained was a scar, a changed face, a body that healed, but never quite the same. Ethan drifted in and out of sleep, haunted by the memory of the surgery, the smell of antiseptic, the sound of suction, the weight of drains. But each morning he woke, breathing, bleeding, healing. A second chance. He closed his eyes again. In the sterile hospital light, amid the beeping monitors and soundless alarms, he promised himself, if he made it out, he would tell this story. He would warn others. He would not let this happen again, not to him, not to anyone else. When Ethan was discharged from the hospital a week after surgery, he was relieved, but not ready. His body was healing, yes. The swelling had gone down enough for him to talk without slurring, but the pain still pulsed through his face every few hours, especially when he tried to eat or move his mouth too wide. He walked out of Denver Regional Medical Center with a plastic bag of medications, a printed list of wound care instructions, and a fresh stack of follow-up appointments. But more than anything, he left with a new face, or rather, a changed one. At home, standing in front of the bathroom mirror, Ethan peeled off the gauze, covering his jaw, and stared at the scar, a pink, jagged line that ran along his jawline, curving slightly up toward his ear. The skin around it was still inflamed, and stitches were visible beneath the clear surgical tape. But what hit him the hardest was the hollowness. Where the abscess had been drained, a depression remained, a noticeable concavity in the contour of his face. Even without the swelling, his left cheek didn't match the right anymore. It sloped inward slightly, a shadow forming in the area where tissue had once been. The left side of his lip drooped faintly. His smile was now asymmetrical. His beard, once thick and evenly trimmed, had been shaved off completely on the left side for the surgery. On the right, it still grew in full and dark, but the imbalance made the difference all the more obvious. When he touched his cheek, it felt rubbery, until suddenly it didn't feel like anything at all. There was a stretch of skin, from the corner of his mouth to halfway down his jaw, that was completely numb, no sensation, no warmth, no pain, just absence. The nerve damage was likely permanent, Dr. Patterson had explained. The infection had inflamed the surrounding tissue so much that the sensory nerves feeding his cheek and lower lip had either been compressed or irreparably damaged during the debridement. Over time, his body might recover partial feeling, or it might not. Amber stood quietly behind him, watching him examine his face. "It doesn't change who you are," she whispered, wrapping her arms around him from behind. But Ethan didn't answer, not because he didn't appreciate her comfort, but because he didn't believe her. Not yet. The first week at home was filled with frustration, changing dressings, cleaning the internal incision inside his mouth with saline rinses, taking antibiotics and pain meds that made him foggy and irritable. He couldn't eat solid food without pain, could barely sleep on his side, and worst of all, he couldn't stop checking his reflection. He would walk by a mirror and pause, tilt his head, pull at the skin, try to smile, try to feel something, try to look like himself again, but it never worked. At night the nightmares began. He dreamt of his face swelling again, growing grotesquely until it split open. He dreamt of pus erupting from his cheek, of doctors cutting deeper and deeper into his skin. Sometimes he woke up convinced the infection had returned, rushing to the mirror in a panic to inspect his face. But the scar was always there, just waiting. 3 weeks after the surgery, Ethan returned to work part-time. His coworkers were polite, careful, too careful. Some of them offered sympathetic smiles, others avoided looking directly at his face. James, who had seen the swelling start during that fateful meeting, was the only one who brought it up directly. "Man, I'm just glad you're alive," James said, clapping him lightly on the shoulder. "You scared the hell out of us." Ethan nodded. "Yeah, me too, but things weren't the same." He couldn't concentrate as well. Every time someone glanced at his face during a meeting, his mind spiraled. Were they staring at the scar, the asymmetry? Were they judging him? He'd been a confident presenter before the surgery, clear, charismatic, self-assured. Now, he stumbled over words, lost his train of thought, felt the tug of self-consciousness every time he saw his reflection in a window. His boss pulled him aside after a few days. "Ethan, if you need more time, that's okay. You've been through a lot." "I'm fine," Ethan replied too quickly. But he wasn't. Amber tried to be supportive. She cooked soft meals, went to follow-up appointments with him, helped clean his incision site. But something had shifted between them, something Ethan couldn't quite name. Maybe it was how she looked at him sometimes, her eyes lingering on the left side of his face before she looked away. Or maybe it was the way she hesitated before kissing him now, her lips brushing the numb part of his cheek too gently, like she was afraid it would hurt. Or maybe it was just his own insecurity warping everything she did. They argued more now, over small things, over nothing, over everything. One night she finally said what he'd been avoiding. "You're not letting me in, Ethan. You won't talk about it." He stared at the floor. "What's there to say? I look in the mirror and I don't recognize myself." She came closer. "But I still do. I still see you." He wanted to believe her, but he didn't know how. By month 2, Ethan had begun researching reconstructive surgery options. Dr. Patterson had mentioned the possibility of fat grafting, harvesting fat from another part of his body and injecting it into the hollow in his cheek. It wouldn't fix the nerve damage, it wouldn't erase the scar, but it might restore the contour, the shape, the symmetry. The initial consultation was promising. The plastic surgeon, Dr. Vasquez, was calm and optimistic. "We'd likely need multiple sessions, spaced a few months apart," she explained. "Fat grafting is subtle, but it can make a real difference in facial volume." But then came the blow, the cost. Over $20,000 for a full set of grafting sessions, not including potential revisions, and since it was considered cosmetic, his insurance wouldn't cover any of it. Ethan left the consultation feeling defeated. The hospital bills from the abscess had already drained his savings. There was no way he could afford this. Not now, so he kept the hollow, the scar, the numbness. All of it. Month 3 brought a new wave of emotional collapse. Ethan became obsessed with checking his skin. Every tiny bump, every pore, every ingrown hair was a threat. He'd wake up in the middle of the night to inspect a spot on his chin under a flashlight. Sometimes he pressed on them gently, terrified of repeating the same mistake, but unable to stop. Amber found him one morning in the bathroom, pale and panicked, pressing around his jaw. "It's nothing," she said gently. "Just a pimple, that's what I thought. Last time," he whispered. Eventually, she convinced him to see a therapist. Dr. Linda Carver was patient and warm. She specialized in post-operative trauma and body image disorders. It took several sessions before Ethan could even say the word abscess without choking up. But slowly, piece by piece, he began to unpack the trauma. "You didn't cause this," she said. "You made a decision based on what you knew. It's not your fault the infection developed the way it did." "But I squeezed it," Ethan said. "I made it worse. You're human. You reacted the way most people would. That doesn't mean you deserve what happened." They talked about control, about identity, about masculinity and self-image and the crushing weight of shame. Ethan realized he had been grieving, not just his face, but the version of himself that had existed before. The confident, unscarred man with the full beard and the easy smile. That version was gone. And he hadn't yet accepted the one who remained. 6 months after the surgery, Ethan finally went through with a single fat grafting session, just enough to slightly restore the depression in his cheek. It wasn't perfect, but it helped. The result was subtle. The scar was still there, though it had faded to a pale pink line. The asymmetry was still visible if you looked closely. But Ethan looked at his reflection and saw a face that looked more like his own. Not the old one. But not a stranger anymore either. He and Amber started going to couples counseling. They talked about the fear they'd both felt, the helplessness, the ways it had changed them. She admitted she'd been scared, not of how he looked, but of losing him, of the emotional distance that had crept between them, and slowly they began to rebuild. 1 year after the infection, Ethan made a decision. He recorded a video and uploaded it to social media. In it, he showed photos, his face before, during the swelling, after surgery, and now. He told the story. All of it. "I thought it was just an ingrown hair," he said. "I used a car key to try to get it out. A day later, my face was swelling. Within 48 hours, I was in emergency surgery. They drained a baseball-sized abscess from my jaw. I have permanent nerve damage. A scar. I almost died." He paused. "I'm not telling you this to scare you. I'm telling you because I wish someone had told me. Don't squeeze bumps on your face. Don't assume you know what's under your skin. If something feels wrong, get it checked. It could save your life." Ethan's video didn't go viral overnight, but within a week, it had racked up over 2 million views. The comment section exploded. Some people shared stories of their own infections, minor bumps that turned out to be abscesses, cysts, or worse. Others simply thanked him. "Thank you for this. I thought I was the only one. My cousin had a similar thing happen. She almost lost her eye. I used to pop pimples with a safety pin. Never again." Doctors, nurses, dermatologists. Many left comments explaining the science behind Ethan's ordeal, the danger of facial abscesses, the venous connections that run from the face to the brain, the risk of cavernous sinus thrombosis, the importance of early medical intervention. Some users said it outright. "This story probably saved my life. I had a weird lump on my jaw and was going to pop it. Now I'm going to urgent care." Ethan read every comment, sometimes with tears in his eyes. The pain, the shame, the months of emotional collapse, it was all still there. But now it had meaning. Now it had weight. Now it had helped someone else. He was no longer just the guy with the scar. He was the guy who had survived, who had spoken up, who had turned a mistake into a warning worth sharing. Months later, Dr. Patterson reached out. "We'd like to use your case as a teaching example," he said. "It's one of the clearest progressions from seemingly benign to medically critical I've seen in years." Ethan agreed. His story appeared in a medical journal, complete with CT scans, operative notes, and a detailed breakdown of how a facial abscess can spiral out of control. His name was anonymized in the official report, but he knew it was him. He remembered every second of it. He started being invited to panels, interviews, even podcasts, not because he was a doctor, not because he had credentials, but because he had lived it, and because people listened to stories more than statistics. One day, standing in his bathroom, Ethan looked into the mirror. He ran his fingers along the faint line that traced his jaw. once jagged, now softened into a pale memory. The hollow in his cheek had been partially filled by fat grafting, though a slight asymmetry remained. But now, he smiled. Lopsided, sure, but real. His beard had grown back, thicker, fuller, but he kept the left side trimmed short, a quiet nod to what had happened. Amber came up behind him, wrapping her arms around his waist. "You look good today," she said. He turned slightly. "You think?" She grinned. "Yeah." "Rugged. Survivor chic." They both laughed. Now, when Ethan sees people fidgeting with their skin, picking at their face, squeezing spots in public, he gently interrupts. "Hey," he says, "don't do that. You have no idea what could be under there." Sometimes they laugh it off, sometimes they roll their eyes, but sometimes they listen. And that's enough. So here's what Ethan Brooks wants you to remember. If you feel a bump in your beard, your cheek, your jaw, don't assume. Don't squeeze it. Don't stab it with something sharp. Don't try to fix it yourself in the rearview mirror of your car. That ingrown hair could be an abscess. That abscess could spread. That spread could end your life, or change it forever. He thought it was nothing, a tiny irritation, a grooming issue. But within 48 hours his face had swelled to the size of a melon. He was in an operating room with tubes draining pus from his neck and cheek. He almost died. He lost part of his nerve function. He carries scars, visible and invisible, that may never fully fade, all because of one moment, one assumption, one squeeze. Don't let this be your story. If you notice anything unusual on your face or neck, especially if it's swollen, painful, or growing, get it checked by a professional. It's not about being paranoid. It's about being safe. And if you've been through something similar, if you've faced trauma or disfigurement or shame over how you look now, know this. You are not alone. You are not broken. You are not defined by what happened to you. Have you ever experienced a medical scare from something small? Know someone who squeezes every pimple they see. Share this story. Tag a friend. Drop a comment. You might just save a face. You might just save a life.